Hi, I'm Matthew Ashton, Director of Public Health for Liverpool. Public health is everybody's business. You don't make a difference to health outcomes by telling people what to do. You make a difference by intensive work right in the heart of our communities, working with, for and through the communities we serve. They say it takes a village to raise a child. Well, this is our village and we are all its children. And that's the beauty of the Community Champions work, working really hard at the heart of our communities to improve health outcomes. The great thing about the Community Champions programme is the work they've done to engage our communities around vaccine hesitancy, encouraging people to take up the vaccine offer and giving the full reasons, the explanation for why vaccination is so important and how bad a virus COVID is.
I just want to say a few words about the Community Champions programme that we've run in Liverpool. We first received approval that we could have a programme back in January 2021. So it's been going 18 months now. I think it's been really successful. We received £600,000 altogether. The main bulk of the funding, about £360,000, has been given to voluntary and community sector organisations who are already working with ethnic minority communities and people with disabilities. That's one of the key success factors of the programme, and we made a conscious decision that was the right thing to do, because them communities and people already working with them are already trusted, and they knew where to go and how to communicate, and it was the right thing to do. Other funding that we've received has been spent on a coordinator post, who is Gosha McCain. And I think that's been another success factor, because Gosha, as well as previously working with the local authority, has got experience of setting up a voluntary and community sector. Gosha's trusted by voluntary and community sector partners, but she's also brought all the organisations together in a developmental way and a learning way. So when the programme is finished, there will be a legacy. I think the other factor that's been really important is getting some of the intelligence about communities, and through a piece of research we did with Creative Organisations of Liverpool, we've managed to get some greater insight into what works within different communities. The intelligence that we've received from both public health but also health partners, and the intelligence that we've received from people on the ground about what works and what doesn't. So yeah, I'd like to just thank everybody who's been working in the Community Champions programme, and hopefully we can build on the lessons learned and carry this forward in some way.
I had the privilege to work with a fantastic group of minority communities who were commissioned through the COVID-19 program. It was Community Champions program funded by the government, and we had 11 organizations that were commissioned, representing different minority communities and organizations that works with people with disabilities. I brought all the community champions all together into our development days. So once a month we met for a full day of work, when we had the chance to look at the program, look at the priorities, talk about the experience we already have, share that experience for people to get to know each other. There's a lot of expertise in the communities, and that's, for me, it's really important. And it was great that this group could share it between them. Actually, even before we started, because of COVID, we had to go straight into actions. So one of the first big things we've done was contribute to the Grab a Jab mass vaccination event at Sefton Park. Over 2 weekends, there were 6,000 people vaccinated, and we understood that there would be lots of people from the minority communities who may not be able to speak English, and therefore we would provide interpreters. So through community champions, with them and their volunteers, we had 44 interpreters speaking 21 languages. That was phenomenal. One of the big issues was when the testing was required, again, the minority communities often didn't have access to test kits. So again, we worked with Ian and a fantastic team really, who was providing the test kits. So we managed to distribute them to different community centers. And because of that, I think our relationship with other partners like public health, CCG, the local primary care networks and GP practices was really good. Was really good base, and then we linked with the local vaccination pop-ups and with vaccination buses. And together with community champions at our development days, we look at how we can address all the different barriers to local services, to health service, to kind of understanding what's happening. But actually they're experts in their communities. They know what works, what doesn't. So this program became like a bridge between the local services and the community champions to look at how we can do things better. We've done amazing work with Kirsty McAvoy regarding health inequalities, again, addressing simple things like accessing GP practice. I think for me, the unexpected benefit of this program was how amazing this group became, the group of community champions. They have their own identity now. They are such a strong voice of the communities. We had different representatives from the community, from the local services coming to consult with them, and they are such expert speakers on what's happening with the community, what works, what doesn't, how things can be changed. I think the part of the project that's important for me is that innovation. We need to understand that the way we develop and deliver services in the future has to be different and has to work for the communities, but with the communities. The community champions offer that variety of way of communicating with their communities in a way that the communities understand, because they trust them, because those organizations are here for years and contributed so much into the community development. And I hope that project will run for years and years. Thank you.
We're part of the creative organisations of Liverpool Network, who were asked by Public Health Liverpool to do some research with the ethnic minority communities in Liverpool, to find some information about how the ethnic minority communities worked and operated, the barriers that they experienced when accessing services, and the impact really that COVID had on the different communities involved. And this brought up a wealth of information and knowledge, which we hope will be used in the future to sort of inform the development of services by the council.
And last year I was working alongside the NHS, Liverpool CCG, and social care, various other partners to address inequalities and vaccination uptake across the city. One of the projects that we ran last year very successfully was a vaccination bus, which was in partnership with Mersey Travel and Arriva, who provided a bus for us and converted it. The aim of that project really was to try to reduce inequalities and take up of the vaccination, and try to reach people who would be excluded from the vaccination. the project as a whole wouldn't have been a success without the partnership with the community champions, because it really was about having those conversations and bringing people along who wouldn't otherwise have been aware of it.
Hi, I'm Kate Taylor. I'm a GP at Dingle Park Practice in Liverpool 8 and I've worked here for 20 years. I'm also one of the clinical directors of Central Liverpool Primary Care Network. We are the most ethnically diverse PCN in Liverpool, and a big part of our role was to deliver the COVID vaccination programme to our patients and a lot of the other populations in Liverpool. And the community champions were a big part of this. So from supporting our enormous 1,000 patient pop-ups in Sefton Park to doing one supporting role for one Roma woman on the vaccine bus, amongst lots of other things, and inspiring other PCNs to do pop-ups, I think our community champions have really been a key part of the vaccination programme. From me and Central Liverpool Primary Care Network, a big thank you to our community champions.
456 789.
Hi, my name's Vicky Doyle. I'm the Capacity Development Lead for the Liverpool Vaccine Equity Project. I'm Director of Capacity Development International, based here in Liverpool. And we've been working really closely with the community champions to look at how can we reduce vaccine inequalities in Liverpool. There's a 40% difference in uptake between the richest and the poorest areas of Liverpool, and this really is not good enough.
I'm the community mobiliser, and I'm working with the community champions, the community innovation teams, and the whole point of what I've been doing is trying to join up the Liverpool School of Tropical Medicine with the community innovation teams and other stakeholders to take a community-focused approach to addressing health inequalities.
Okay, so the community champions, they've really been the driving force behind those community innovation teams because they know their communities best. So by working through them, they've been really able to use local data to come up with local solutions.
They've also gone out and been able to identify people in the community who are willing to be filmed and share their personal experiences, and it's been amazing working with the community innovation team, a real inspiration.
So we're hoping moving forwards that we're going to work towards a far more integrated model of care, and really that's what we see the way going forward. Thank you.